Our bodies need glucose for energy. It's like fuel for our cells. But too much glucose in the blood can be harmful. That's where glucose tolerance tests come in. These tests measure how well our bodies process glucose. They help doctors diagnose diabetes, prediabetes, and other conditions. By understanding how our bodies handle glucose, we can take steps to stay healthy. Glucose tolerance tests involve giving a measured amount of glucose and then tracking blood sugar levels over time. This information reveals how effectively the body uses and regulates glucose in the bloodstream. The oral glucose tolerance test, or OGTT, is the most common type of glucose tolerance test. It involves drinking a sugary solution and having blood drawn at specific intervals. First, you'll fast for at least 8 hours before the test. Then, a baseline blood sample is taken. Next, you drink a standard glucose solution. Your blood will be drawn again 1 hour, 2 hours, and sometimes 3 hours later. This allows doctors to see how your body responds to the glucose. The intravenous glucose tolerance test, or IVGTT, delivers glucose directly into the bloodstream through a vein. This method is less common than the OGTT, but offers advantages in certain situations. The IVGTT is used when oral ingestion of glucose is not possible or reliable. It provides a more controlled delivery of glucose, which is helpful for research purposes or for individuals with conditions affecting glucose absorption in the digestive system. Like the OGTT, the IVGTT involves multiple blood draws over time to monitor glucose levels. However, the timing and frequency of blood samples may differ. Proper preparation is crucial for accurate glucose tolerance test results. Factors like diet, medications, and physical activity can influence blood sugar levels. Your doctor will provide specific instructions, but generally you'll need to fast for at least 8 hours before the test. This means no food or caloric beverages. You should also avoid alcohol, caffeine, and smoking for several hours before the test. Inform your doctor about any medications or supplements you take, as they may need to be adjusted temporarily. After the blood samples are collected, they are sent to a laboratory for analysis. Technicians measure the amount of glucose in each sample, providing a timeline of your body's response. These measurements are compared to established reference ranges to determine if your blood sugar levels fall within a healthy range. The American Diabetes Association, or ADA, sets specific criteria for diagnosing diabetes and prediabetes based on glucose tolerance test results. Abnormal results may indicate insulin resistance, prediabetes, or diabetes. Insulin is a hormone that helps cells absorb glucose from the blood. When insulin isn't working properly, glucose can build up in the bloodstream. Glucose tolerance tests are valuable tools for diagnosing diabetes, a condition characterized by high blood sugar. They can also identify prediabetes, a state of elevated blood sugar that increases the risk of developing type 2 diabetes. Early detection through glucose tolerance tests allows for timely intervention, lifestyle modifications, and, if necessary, medication to manage blood sugar levels and prevent complications. Untreated diabetes can lead to serious health problems, including heart disease, nerve damage, and vision loss. In addition to diabetes, glucose tolerance tests can be used to diagnose other conditions, such as gestational diabetes, which occurs during pregnancy, and reactive hypoglycemia, characterized by low blood sugar after meals.